Hi, and welcome to this afternoon's nonpartisan virtual briefing. I want to thank the Congressional Black Caucus for offering us the opportunity to collaborate with all of you for today's briefing. I'm Camille Busette, the Executive Vice President of Programs at the Robert Wood Johnson Foundation. The Robert Wood Johnson Foundation is a leading national philanthropy dedicated to taking bold leaps to transform health in our lifetime. For over 50 years, the Robert Wood Johnson Foundation has been a trusted resource for data and analysis that inform policies to improve health and well-being in the United States. Today, we will provide an overview of the Congressional District Health Dashboard, a tool developed by the NYU Grossman School of Medicine in partnership with the Robert Wood Johnson Foundation. We know that high-quality data is fundamental to good policymaking, particularly when it comes to understanding and addressing persistent health disparities in the United States. Yet we also know that it is challenging to find data you can trust that quantifies the challenges facing constituents. And that's why, in partnership with the NYU Grossman School of Medicine, we launched the Congressional District Health Dashboard in 2023. The dashboard now tracks 40 measures of health and its drivers by state and congressional district. Our goal is to provide actionable and nonpartisan data on critical issues such as life expectancy, diabetes rates, uninsurance, and children in poverty, specific to your state and congressional district. Today's conversation will focus on how to use the dashboard to inform policy, constituent relations activities, and communications. I'm really looking forward to our discussion, but before we dive in, a couple of programming notes. We will have plenty of time for Q&A, and we really welcome that. So feel free to share your questions in the Q&A box throughout the discussion. A recording of today's discussion will be shared with you in a follow-up email, along with resources referenced during today's discussion. And near the end of our time, we'll share a link to a brief survey in the chat, and we would really appreciate it if you could complete it for us. And so with that, I'm happy to introduce you today to our speaker. Ben Spoer is the Program Director at the Congressional District Health Dashboard at the NYU Grossman School of Medicine. He and his team have played a crucial role in bringing the dashboard to life and continuing to grow and evolve it to meet policymakers' needs. And Ben, with that, I'm going to ask you to maybe start by giving us a brief overview of the tool and its capabilities.
Yeah, thanks, Dr. Busette. Everyone, my name is Ben Spoer. This picture is, in fact, of me. It's just before the pandemic, so it was like 50 years ago. I'm the program director at the City Health Dashboard and Congressional District Health Dashboard. And the challenge that we attempt to address via the Congressional District Health Dashboard is that until its launch in 2023, rigorous nonpartisan data on health and conditions that affect health were not widely available at the congressional district level. A lot of data were available at the state and county level, and increasingly available at the city level, provided via the City Health Dashboard, which we also produce. But if you needed congressional district level data, they were only really available through the US Census and only available for a few social drivers of health, children poverty or other poverty rates, for example. And they were often substantially delayed, becoming available for a given congressional Congress session pretty much towards the end of that session. And that wasn't enough time for folks to use that information to make informed policy decisions. No slight on the census. We love the census. We use their products extensively, and they have sped up the rate at which they're producing these data. But we felt that these data were essential for such a prominent policy making geography as the congressional district. So next slide, please. So the goal for our website is to provide granular data at the congressional district level, straightforward and unbiased data to help inform and catalyze priority setting. Next slide, please. So what you see here is a map of the congressional districts in the US. It doesn't look exactly like uh, the maps you'll see on the website, partially in color and partially because some of the boundaries have changed since we produced these slides. But the take home from this slide is that to address the challenge of the lack of data at the congressional district level, in partnership with RWJF, we produce the Congressional District Health Dashboard, where we are tracking over 40 measures of health and drivers of health for all U.S. congressional districts, all 50 states, and Washington, D.C. And we're funded through two different focus areas at the Robert Wood Johnson Foundation, both healthy communities and policy. And and I mention it because it really does reflect part of the thought process underlying the tool, which is that policy and health are closely linked to one another. And if you go to the next slide, please, we see that reflected in our audiences, the elected officials, and you all, their staff, people who are advocating for equal opportunities for health for everyone, journalists, researchers, and the public. Next slide. And we on the following slide, which we won't switch to just yet, but you'll see the full list of our metrics. And that relationship between healthy communities and policy, I think, is really visible on that metrics list in which we've been careful to select metrics that meet the criteria in front of you, especially amenable to intervention. A lot of times, in order to affect health at the national level, we need policy changes. And we want to present to you all only metrics that can be intervened on. One of the reasons we've not put up, for instance, a temperature metric on the City Health Dashboard or Congressional District Health Dashboard is that we think that if we tell folks, it's hotter out there than it used to be, we might get a response like, okay, so what should we do about it? And we don't want folks thinking about what they can't do. We want them to focus on things they can do. Otherwise, we are looking at national data sets so that we can provide metrics that are comparable across places. We are looking for rigorous methods that underlie the original data collection, meaning that we want the data we provide you all to be rigorous, of high quality. We want to reflect public health priorities. So, for instance, during the COVID-19 pandemic, we put up a metric that measured COVID transmission and case intensity. And we took it down once the national emergency was declared over. Amenable to intervention, balanced over 4 overarching domains, which you'll see at the next slide, and updated regularly. We try to only use data that are updated at a minimum once per year, though some high-profile data sets are not updated as frequently. Next slide, please. So here's the full list of metrics we currently provide data for. Health outcomes, socioeconomic factors, health behavior, physical environment, and clinical care. These are the 5 domains over which we've tried to balance our metrics. A couple of metrics that we've recently put up that we're particularly proud of include Medicaid enrollment, which we put up earlier this year, youth not in work or school, sometimes known as disconnected youth, and our continual ongoing updates to our unemployment metric. This asterisk that you'll see by some metrics indicate that we have demographic breakdowns for that metric. And the delta that you see, the triangle, show that we have census tract level data, a smaller geography that somewhat approximates, not perfectly approximates, neighborhoods. And I'm going to show that all to you when I share the website with you, which I think is our next slide. Can we move to the next slide? Yeah, so I'm just gonna be so brave And I'm gonna try to put up a website in front of a bunch of folks that I don't know and don't know whether I can use a computer or not. So light your candles, say your prayers, share. And Dr. Busette, you're the only person I can see right now. Do you see the website?
I do. I do see
That's
it.
wonderful.
Yeah,
Thank you so much.
you're welcome.
So if you were wandering the wilds of the internet and you decided to type on Congressional District Health Dashboard.org, you would find our homepage. This is the dashboard's homepage, and in today's demonstration, I'm going to highlight a few key features of the site that we think you might find most useful. Starting from the home page, you can type your state or district into the search bar. Or if you are somebody who doesn't think in congressional districts, you can use a city, an address, or zip code in this second search bar just below the district or state search bar. For today's demonstration, I'm going to use the example of Congresswoman Clark's district, New York's ninth, of which I'm a former resident, to walk you through all the site's features and how you can access the data for your district. So starting from the home page, the district lookup tool will take you to the health snapshot. So I'm going to type in New York ninth. The search function auto populates. And here we are at our health snapshot for New York ninth. So the snapshot feature has two parts, the metrics overview, which we're currently looking at, and then right next to it, sort of in the upper part of the page, we have district facts. And we're talking about metrics overview for a second. The metrics overview page provides a list of all dashboard metrics and the metric estimates for the district you've selected. And you can quickly get an idea. I'm going to scroll a little bit, so my apologies if you've got vertigo. You can quickly get an idea of how the district is doing compared to the national average. So you can filter by domain or specific metrics and find information about the metric and the district estimate and easily make comparisons. One of the ways to easily make comparisons is using this symbol right next to the metric estimate. This green circle that we have for this air pollution ozone metric tells you that the district you're looking at is performing better than the US average for air pollution ozone. We see the same green circle for breast cancer deaths and below it colorectal cancer deaths. This yellow triangle means that the district you're looking at is performing about the same as the rest of the country on this metric. And if we look at, there we go, this red square shows that the district you're looking at is doing a little less well than the US overall. And if we were to hover over this underlined statement, the US average, it'll pop up with a number for you. In this case, we're looking at colorectal cancer deaths. So we can see, just looking from left to right, New York ninth district has 9.8 deaths per 100,000 population. It's got a green circle, so it's doing better than the US average. And then once we put our cursor over this underlined statement, we see the US average is 13.9 deaths per 100,000 population. To demonstrate our filtering feature, I'm going to scroll up to the domain slowly, gently, scroll up to the domain selector, which is over here on the left-hand side of the page, and click on physical environment. And our physical environment metrics include air pollution and some lead metrics. On the City Health Dashboard, we also have a walkability measure that we didn't include on the Congressional District Health Dashboard because lots of congressional districts are less developed than the cities for which we provide the walkability metric, and it didn't quite make sense to compare them across the country. For this domain, physical environment, you can see that New York ninth got a metric doing better than the US average, a metric around the same as the US average, and then a couple that are a little bit below the US average. So you can click on these any of these metrics to be directed to the metric map for that district, which I'll show you in a second. But before we get there, the other feature in the health snapshot page for each district is the district facts. And this gives you some essential information about the district you're looking at that may be useful to reference as you think through and work through the site. At the top, you can see the district's total population above this pie chart, and population charts by age and race and ethnicity. If you scroll down, you may be interested to see the quote, cities in a congressional district feature that cross-links with our sister site, the City Health Dashboard. And below that, the district representation in Congress. Maybe some of you see a familiar face here. Just going back up to the cross-linked feature, you don't see any cities within New York's ninth because New York's ninth is entirely located within New York City, which is a large city with high population density. So as you all know, the congressional districts are pretty small. But if you were to click on this city, or if there were other cities listed, you would be popped right out to the City Health Dashboard, which is taking a second to load, probably because there's just a lot of information on it. I'll show it to you in a moment when it pops up. But you'd be able to get all the metric information and uh, neighborhood level maps and anything else you might want from the City Health Dashboard about that specific city as well. The internet's let me down a little bit, so we'll see if I can come back to that and show it to you later, but otherwise we'll forge our way forward. To move us to another key feature of the dashboard, I'm going to scroll to the top of the page now and show you how to navigate other features, starting with our metric maps. So we're looking at the very top of the website here, next to the Congressional District Health Dashboard logo. We were at Health Snapshots, now we're moving one to the right to metric maps. The first prompt here is to select a metric from the 40 we have on the site, organized by domain. I'm going to click on children in poverty. So we look at the domains, and children in poverty is a social and economic factor, and then it's alphabetical. So children in poverty is right there. And what's going to populate here is a national map of congressional districts. For any metric that we select, the national metric map will populate, giving us the opportunity to explore this metric at a national scale before zooming into a state or district of interest, or to select the district we want from the lookup tool on the left. The metric map shows us how the country, a state, or a district is doing for a particular metric. Each metric map is designed the same way and offers consistent visual signposts that orient the user to what they are seeing. The scale bar up at the top shows the range of values for the metric, and the color gradient signals more or less desirable outcomes. Across the dashboard's metrics, darker colors indicate poorer outcomes, and lighter colors indicate better outcomes. I'm going to select once again New York's ninth. For any of you working with New York's ninth, thank you for indulging us as we spotlight your district. I can use a couple when we load district New York's ninth, I can use a couple of visual tools to better understand the data for this district in the context of the surrounding districts on the map and in comparison with the national average using the scale bar. So at the top of the page, once again, we have the scale bar, and you'll see this bar with the 21.5 above it. That represents the estimate of children in poverty for New York's ninth district. And over here in this, below this caret, at 15.6, we have the US average. So we get, using the scale bar, sort of an instantaneous idea of how the district we're interested in is performing on this metric. If we scroll down a little bit, I'm also going to zoom out a little bit just to give you all an idea of where we're at in the New York City map. If we scroll and zoom, New York's ninth district is highlighted with an orange border. We can also better understand the district level estimate for children in poverty by comparing the value to surrounding districts on the map. So if we look at this, so New York ninth highlighted here is 21.5%. We might wonder what's going on deeper into Brooklyn. So we'll click on New York's eighth and see that the estimate for children in poverty is a little bit higher. And then if we compare it to Central Manhattan, we see Central Manhattan has a very low estimate. So this just gives us a quick, and I'm pulling the map down a little bit to center our numbers. This gives us a very quick way to do some on-the-fly comparisons. I'm just gonna close out these pop-ups for to make it a little easier to see the map. Um, So the dashboards also provide multi-year data for our metrics. When available, you can toggle between years here on the left-hand side of the page. I'm going to click on it, and you should see that we have data going back to 2020 for this metric. We will have data back to 2020 for most of our metrics from this same data source. Here you can also easily move between other districts, metrics, and metric years. For instance, you could change your metric right here under children in poverty by clicking change metric. You can look for a different state or district in this search box. Uh, uh, and you can, excuse me, you can change the comparison value here. If you're more interested in comparing your district to the state, you could click this drop down and switch to the New York value. You can also download the map or the scale bar. So if you need to make a point using data visualization, make a point quickly to somebody, or need to, in a flash, update a presentation, you can grab some of these graphics and add it to that presentation or briefing uh, uh, pretty quickly because we know that congressional staffers are often under a lot of time pressure. And for metrics for which we have census tract level data, you can view census tract level estimates within the district you've selected. So I'm going to zoom in a little bit just to give the computer a break because I'm about to ask it to load a lot of information. And then I'm going to click this button that says show census tracts. And what you see here is that there's substantial geographic variation across place in children in poverty in New York's ninth district. We'll zoom in even one more. And so in the northern part of the district, there are a couple of census tracts in which children in poverty is particularly high. The first one we clicked on here is 62% of the children living in poverty. We've got a 58 and a 70 over here. And there's some other census tracts that have much lower children in poverty. And, sometimes we get questions from data skeptics. There are more and more data skeptics in the world now than there used to be. And they say, can I really believe what I'm seeing? And what we often do is take a look at data for their hometown, their home district, and ask them if what they're seeing on the map correlates with how they understand the world. Do they believe that these areas nearer Prospect Park, nearer this municipal amenity that many people love, do they believe that those tracts have lower children in poverty, whereas some of these other tracts further out might have higher children in poverty? Overwhelmingly, the answer is yes, that the data they're seeing on our website reflects the world as they understand it. And it takes us a huge step forward toward helping folks to not only understand, but come to trust the data that we are able to provide them. And we get to move past that skepticism moment and towards solutioning for solving the health challenges that we all want to together solve. Similar to the district navigation, you can also click into each individual tract as you just saw. Another entry point for exploring our dashboards is our metrics by demographics page. So we're back up at the very tippy top of the website here, and we click on metrics by demographics. We're going to select New York ninth again, and we get a pop-up in which we see that we can access metric breakdowns, demographic breakdowns for about a third of our metrics. As you enter your geographic area of interest, the metrics with the demographic data are available. We're going to click on uninsured here, and what you'll see is that you can get demographic breakdowns by sex, by race and ethnicity, and by age for these key metrics. And we think that this particular tool is especially important for folks who are thinking about disparities across whatever demographic groups you may be interested in. And it sort of speaks nicely to the census tract level maps because on the census tract level maps, we can get a quick visual sense for geographic disparities. And in the demographics page, we get a quick visual sense for disparities by demographic groups. Uh, for the sake of time, I'm just going to highlight one or two other features. On the tippy top, again, you'll see this compare districts method, this compare districts tab. What that allows you to do is add other districts that you may think you are comparable to, or that you may think you're not comparable to, and you want more information about. So you may add 5 other districts in your same state. You can also add the state itself. So for the case, for the sake of this example, you might add New York State. And then you'll get you'll get the scale bars for all the districts that you've listed and the state if you do so, and metric maps. And so it helps you to locate your district's performance for the metrics you're interested in comparison to other places you might be compared to. In the metric background page, you can click on any one of our metrics and get a pretty thoughtful, at least we think so, a pretty thoughtful rundown on all of the why and how for a given metric. So if you were to click on children in poverty here, you'd see the formula we use to calculate children in poverty. You'd get the census table numbers that we use because some of us dream in census table numbers, and we love that. We're proud of ourselves. And also why we chose to calculate this metric. And so for children in poverty, it may be self-evident. Some of the other ones, it may be interesting to find out why we chose youth not in work or school, or more importantly, why we want to frame it as youth not in work or school, not disconnected youth, which I'll just tell you that we felt that disconnected youth didn't quite cover all of the ways that youth can be connected to the world. And there's a little hint of a judgment there that we didn't want to approach. And then finally, the last thing I'll show you is access our data. If you click on this menu button, you see access the data on the bottom here. You'll be asked to fill out a short form, most of the responses to which are optional. We're not really harvesting very much information. What you're able to do there is download any and all of our data. You can select just the metric you want, just the district or state you want, so you don't get this overwhelmingly bulky, confusing spreadsheet. But what it provides you is the ability to interrogate and analyze our data to your heart's content, really. If you're going to access the data, if you're going to download it, we also suggest that you download the code book and data dictionary so that you can read up on all the ways that we organize the data so that you're not trying to guess what our variable labels mean. And the last thing I'll say about this before I pass it back to Dr. Busette is we really value transparency. If there's anything that you're wondering about, I should say, or worrying about, honestly, that I haven't answered, you should drop a question in the chat or reach out to us because we want to answer your questions. We want to make this as clear, trustworthy, and robust a source as possible. And if there's something that we haven't explained or explained exclusively in academic jargon, it's purely something we want to fix. It would be never intentional obfuscation. So don't hesitate to reach out to us. And as a final callback, here's the City Health Dashboard page for New York, New York. You can see we have the scale bars and the carrots for all of our metrics. So knowing how to use the Congressional District Health Dashboard will cause you to also know how to use the City Health Dashboard. I'm going to stop sharing and turn it back over to Dr. Busette. Thank you so much.
Ben, thank you so much for that. That was wonderful. As you all can see, the tool has many capabilities that can help support policymakers' work. For example, as we can see here, the dashboard can help illuminate issues in districts that may have otherwise been hidden, like racial, geographic, and other disparities. And it can also be used to target policies, programs, and resources more effectively. We also think that this will help policymakers communicate with constituents, providing data to bring issues to life in press releases, statements, town halls, and other communications. And now we're going to take questions from you, from the audience. But as folks submit any questions that they may have via the chat, I'm going to start with a couple of conversation starting questions for you, Ben. And the first one is, can you talk a little bit more about the importance of data in addressing health disparities?
Yeah, it's a great question. We are thinking about it constantly. And there's two ways that I personally think about it, one of which I think is totally visible on the website. First is I think there's broad agreement that health outcomes are differentially distributed across various different ways of measuring and organizing health outcomes, right? Place, race, ethnicity, sex or gender, income strata. And it's hard to wrap one's head around that in abstract. It's also hard to figure out data. It's just like this sort of complex monolith, and uh, federal data sources can be hard to work with unless you've spent years like staring at census table numbers, you know. I wouldn't wish that on anybody. We're, again, very proud of ourselves, but you don't have to be that person. And so until we're able to see these data laid out in a way that are visualized simply and easily, it can be difficult to get the conversation going. And in our experience, because, you know, we've been demonstrating the Congressional District Health Dashboard for since 2020, early 2023 now, and even longer on the City Health Dashboard. Folks often see the website and they look for their home, the place they care about the most. And then they see, you know, does this make sense? And I was sort of alluding to this earlier. Does the world reflected in these data also reflect my lived experience? And if once the answer to that is yes, which it almost always is, then the conversation becomes, why is it that even in my hometown or my home district, there are such big differences? Do the people in the neighborhood across the street really do the kids there deserve to be living in poverty? What has happened? And often the answer to that question is not articulated because people are already thinking about solutions. And so we think about the data not as necessarily persuasive, though it has been persuasive at times, but as a conversation starter. It sets the table for people thinking about Thanksgiving next week. It's the table on which people sit down and at which people sit down and have the important conversations, even if they're tough. And then personally, I also saw a post from another RWJ staffer at one point, another being not Dr. Busette, that said, you know, how did we make our important data related, health disparity related decisions before we had good data? We made them using the same beliefs and intentions that produce the systems we've been living in. And that scares me because the systems we've been living in produce the outcomes we're currently struggling with. And we need to do it a different way in order to get better outcomes. And data can be part of setting the platform, the table even for those outcomes.
Thanks, Ben. I think it's important to highlight that data is a good conversation starter to really tackle some tougher and more challenging issues. I appreciate that. A second question for you, can you provide some specific examples of how data from the dashboard
Mhm.
has or could be applied to inform policy?
Yeah. Our favorite example so far was that we happened to release the Medicaid metric right around when the budget bill was being heavily debated. And so many journalists grabbed our data and ran with them. And I have a list here, but our data were featured in CNN, Politico, and Fortune, and were used by a couple of other publications, including the New York Times, and numerous local outlets like California, like state at the state level and local level in California, Tennessee, Colorado, and Minnesota. And so it's not the case that we saw someone in a hearing in the Senate hold up a chart that had our logo on it, though that's another dream that when we're not dreaming about census table numbers, that's what we dream about. But we have seen it used as a way to help both policymakers and the general public think through how policy will change health outcomes. Uh, in thinking about how they could be used, our data can support members and staff, sorry, to identify opportunities and challenges in their district or state, to find data that confirm what they're hearing on the ground. And also sometimes you get like the hot tip from the constituent, and then hopefully folks will get that hot tip and go to the Congressional District Health Dashboard and see uh, see those that play out. Um, there are so many other use cases we can think of, but those are probably the top.
Great, thanks very much for that. We have a question from the audience, and thank you very much for submitting this. Um, there's a question about, is there any plan to add any other metrics in the future, for instance, like asthma rates?
Yeah, it's a great question because we often get asked about asthma rates specifically and new metrics in general. So our next data release for the Congressional District Health Dashboard is slated to be in the first 10 days. I believe it's March 9th, 2026. So early March 2026. We do have a couple of metrics in development. I'm sorry to say that asthma isn't on the list right now. And one of the reasons we haven't developed it thoroughly is that most of the public health conversations we've heard about asthma are about childhood asthma, and most of the data available to us are adult asthma. And we're also conscious that 40 metrics is already a lot. And there's a point at which people can click onto a website and look at it and be immediately alienated by the amount of thinking and decisions they have to make. The next metric we're thinking to add is if we can get it right, this is definitely in the R&D phase, so I can't make any promises, but we're working on SNAP enrollment and or I should say participation, pardon me, SNAP participation, and we're working on congressional district level life expectancy estimates, which would be aggregated from county level mortality data. If you're out there and you think we've got it all wrong and we should be working day and night on asthma, we will listen to you as a member of congressional staff. So just email us and we'll talk.
Great, thanks for that, Ben. There's another question more about your data sources.
Mhm.
So, what is your plan if public data collection programs from the federal government are disrupted due to funding cuts or personnel loss?
Well, so it's a great question. I've talked too much about dreams, but sometimes in our nightmares there are no more federal data. And so there's a bit of good news, bad news here. The two pieces of good news are one that our next update has not been affected. We expect our next update to 2026 update to go forward without problems. And that's primarily because the data machinery moves at a deliberate pace. So the data that informs the 2026 update represent uh, uh, health conditions and outcomes from 2024, right? So that data was collected a while ago, a couple years ago, and it takes a while to put it all into the computer and to analyze it and to make sure that it's valid, and then for the federal agencies to release it. So that's one. Two is the shutdown and the reorganizations at CDC have already caused some disruption to some of the big data sources that we rely on. And so for a bit of a frame of reference, our main three data sources are the US Census, the American Community Survey, which we use their 5-year estimates because the 5-year estimates have enough of a geographic variation in the sample over the 5 years to produce estimates for the whole country. We use 5-year estimates from ACS. We use the NCHS, National Center for Health Statistics, mortality and natality data, their birth and death records. And then we have been using CDC Places, which was a project within CDC that took responses to the behavioral risk factor surveillance system and some fancy math, which I say not to put a black box around it, but just because I don't have a whiteboard behind me. Use some math to get these estimates down to the census tract level, right? So the team that created CDC Places has been riffed, and the estimates that fed Places uh, uh, the process of collecting those for the 2025 data were interrupted by the reorgs and the shutdown. So they've also come back up to speed after the shutdown, right? So we are seeing some resilience amongst our federal data collection efforts, which none of us should be surprised that the federal staff are resilient and resourceful, right? We know that, and we see another example of it here. On our end, we're also working to create fancy math and other approaches that help us maximize the data that we do have. So one example is that the data that feeds places, the BRFSS data, is made available by some states on State Department of Health websites. And so one of our interns is doing the yeoman's work of creating a list of all the states that release those data and where we can find them. And then our job is to use a combination of multi-level statistical modeling and some AI, though we watch it like a hawk, some AI to try and fill in whatever blank spots may exist on the map after we get all the really solid data that we can get. We're also looking at electronic health records, and electronic health records are data collection systems through which hospitals and health clinics report all the information for everybody who visits those hospitals and health systems to a master database. And the strengths of it are that these metrics are like instantaneously up to date. There's like a 1 week lag because it's uh, collected procedurally. The downside is that you only get information from the hospitals and clinics in those places, and only for the people that goes to those hospitals and clinics, right? So if you ever heard a stereotype about how men just don't go to the doctor, well, it's a stereotype because there's a little bit of truth to it, and men tend to be underrepresented in these EHR data. And so we're working hard, and luckily one of our PIs is sort of a national expert on this, on how do we adjust for the bias in EHR so we can create data that you all can trust. We were thinking about some of these issues before uh, uh, there were all these changes at the federal level. We've been thinking about them a lot faster, no less rigorously, but a lot faster since these changes started to happen. And that is assuming, of course, that RWJF's efforts to support and push forward our federal data systems don't just fix the problem, right? And when we're in particularly optimistic moods, we believe that all of the leadership RWJF is providing on this issue is gonna break through and cause us to not have to worry about it anymore. And that's my roundabout way of saying, thank you to RWJF as well for staking out a leadership position in maintaining and pushing for these federal data sources, which are crucial to the nation's health.
Thank you, Ben, and thanks for giving a sense of optimism around that. And that was a great question. We have another two-part question, so I'm going to give them both, and then, of course, if you need me uh, to repeat the second part of the question, I'm happy to do that. So, what are some of the challenges to obtaining data that is disaggregated by race and ethnicity? And I would probably just toss in gender there as well, since gender is an important distinction in medical data. And the second part of the question is, what are some strategies to improve access to disaggregated data?
Yeah, it's a great question. As you can tell, disaggregating our data is important to us. And especially on the City Health Dashboard, we've provided the maximum level of granularity that is available through the US Census for the race and ethnicity breakdowns, which means that a lot of places will have 0% for a lot of race eth groups because you can get down to tertiary groups like Nepalese, Cambodian, Bhutanese. But if we don't put these people on the map, who's going to do it? And one of the things I feel some frustration about with my own industry, public health, is that these data are often available. We just don't use them for reasons that I can't fathom. One of the big challenges is the willingness, of course. Another is that many data sources don't collect data disaggregated by race and ethnicity or gender, right? And I feel for these data sources because every question you add to a big survey costs lots and lots of money, right? And time and effort. And is this the question that's going to cause the ethics panel to reject your proposal, your idea? But there's never been a good excuse for obscuring people's lived experience. And there's reasons, but they're not good excuses. We have amongst our three data sources, there's a substantial our three major data sources, I should say, sorry, there's substantial variation in what disaggregated data are available. The US Census provides a lot of granular race and ethnicity and gender and age estimates. The vital statistics, the mortality and natality data, we go through a somewhat lengthy and careful application process to be able to access the mortality and natality data in a way that's more granular than someone can just publicly via the internet. And by doing so, we can access data that provides some race and ethnicity and or biological sex gender breakdowns. One of the ways we accomplish that is by pooling data across years. And so so what we're thinking about here is that if you for a certain year, for a single year, if a certain cause of death is not the cause of death for enough people, then you can't release those data. It's a privacy problem, right? We didn't want to announce to the world that, seven people or three people in this category died of this cause and have them say, oh, well, my neighbor died last year and it must have been for that reason. That's a breach of privacy. So we combine years of data and we access these restricted data so that there's enough information available that we don't risk privacy disclosure. Another problem with the CDC Places data set is that the estimates are modeled. And the reason they're modeled is that we're trying to maximize what we can do with these data sources. And the way we're doing that is we're extracting more information from less directly observed counts. And that often means that we cannot provide race and ethnicity breakdowns because it's difficult to reliably, robustly generalize into those smaller groups. At the end of the day, you can't really invent new data. You can only maximize what you have. And if we don't have enough information about these race and ethnicity groups, then we can't sort of inflate or make up any information in order to fill them out. And then we just have to apologize. I think I did a good job with the challenges, but you were right that I was going to forget the second part. Did I get the
Yeah, no
second part?
worries. What are some of the strategies to improve access to disaggregated data? I feel like you talked about some of them, but you might have some that you want to highlight.
Yeah, so some of the strategies include first making maximum use of what we do have, and that's sort of what I was griping about at the beginning of my TED talk there. That we have some of these data and we don't use them, right? Another is, and I will brag for a second, by making them visible via tools like the City Health Dashboard and Congressional District Health Dashboard, we are putting into the spotlight health disparities in a way that is not often done elsewhere. And I can think of three or four other tools that do a great job of it, but three or four tools in the whole world wide web is not a tremendous number. And so our hope is that, in a little bit of a callback here, People go to the city health dashboard or the Congressional District Health Dashboard. They look at a map of a place they care about and they say, it bothers me that the people over here have fewer opportunities or less celebratory circumstances than the people over here. And if we can just get people to take one or two actions based on that feeling of frustration, then we have helped move the country towards a state of fewer health disparities. And that is the dream.
Great. Thank you so much for that. Another question for you from the audience is,
Mhm.
are you available for additional walkthroughs of the dashboard with specific offices in more of a one-on-one kind of setting?
Yeah, I don't know how to say this without sounding too desperate or too eager. It's like I want to play it cool, but I really can't. Yes, we want to talk to you. Email us, call us, send us a postcard, whatever. We will look up to the sky for the skywriter that you hire. Just reach out to us and we will set up a time.
I think your enthusiasm for that is pretty
Enthusiasm.
obvious. So,
That's so much better than my version.
um, uh, does access to the dashboard require any payment or subscription? And how can users find out when data has been added or updated?
So it's all totally free. And man, should I have said that at the top or what? It's all available just out there at the internet, on the internet. So if you go to Congressional District Health Dashboard.org, you can see everything. Um, in order to download the data, we do ask that you share a little bit of your information, but there's no cost to it. It's all free to download. And the best way to find out when we're going to update data, because we do two updates a year, one big one in the winter and one smaller one in the fall, is by subscribing to our newsletter or following us on LinkedIn. And I think we'll put up a last slide in a minute or two that has a QR code and our info at email address, and we are ready to hear from you. We are enthusiastic about hearing from you.
Yeah, and we will also provide this information by email as well, so everybody will have access to it. One final question for you. Aside from informing policy work, how can congressional offices use the dashboard to promote health in their districts?
Yeah, I think that when I could see these data on stage at a town hall, I really could. It's like, if I pretend to be a congressional representative, which I'll do a bad job of, but we're working on this policy because of this reason that we heard about from you, and look at these data that reflect that need for this community, right? Like we're not doing it because a friend of ours works in this industry or something. We're doing it because things are not as good over here as they are over there. We want to even that out. Um, I could imagine in testimony on the floor, in a chart or a graph. That's one of the reasons we try to make it so easy to download. And also, if we never see it out in public, but you reference it when you're having policy conversations in your offices, that's a totally fantastic use of the website and the data.
Thank you, Ben. This was incredibly valuable. And so, unfortunately, we are coming to the close of our session. I do want to extend a really huge and very warm thank you to Dr. Ben Spoer for sharing his insights and expertise, and again to the Congressional Black Caucus for inviting us to this conversation. I want to thank all of you for participating in the discussion, and we really appreciate your time and your interest. We've put a link to the chat for a brief anonymous survey, and we would really appreciate your completing that to help us plan future events. Obviously, we'll be providing a recording of this webinar and a link to the survey. And thank you all, and have a great rest of your day.